Hello everyone, my name is Attila, and today I will be talking about how we can ascend with pharmacology for bone growth, or more scientific term, osteoblast, creating osteoblasts and bone formation. So before we get started, I don't take any stuff, I don't take any drugs, I do not take anything, I do not want you to take anything, I do not know anything about this, I'm not a teacher, I'm not a medical, so all this is for educational purposes only, and not even educational, just for fun, just me sharing my information. Um, so yeah, okay. Number one is, for example, this is just a hypothetical for a patient that had severe deformity, if that's a word, and wanted to take his own steps. And I'm not telling you to do this. I'm just saying if you do it safely and do it right, and that's where I come in. Okay, do not take anything. It's bad for you. Okay, so I'm gonna go over the compounds, why you should take them, and what you should take with what doses recommended for starter, and then how to prevent side effects. So first of all, we need testosterone. Either testosterone cypionate, it doesn't matter. We need something that testosterone just upregulates our testosterone levels, binds to androgen receptors in our bones, muscles, just good for us overall. It's also just good for our mental sharpness, just everything. Dosing for this, and it's also good for bone formation. One of the reasons is from aromatization, which helps us, which I will discuss. So dose, I would say absolutely you should be shredded, not shredded, at under 18, sub 18% body fat to take this compound. Because if you're above 18% body fat, then you will aromatize heavily and that will cause issues. And if you're a teen Roid cell, which I know many of us watching are, this is not great. So please be lean. It's because your fat cells, if you're fat and high body fat, your body will aromatize from the excess testosterone. So yeah, dosing would be around, if you're lean, I would go as high as 250 milligrams testosterone, because that's basically how much you need for bone growth. Okay, and if you're not a lean guy, also you should get your blood work done before as well for safety. But anyways, yeah, 150 milligrams to 250 milligrams, and you should do it with insulin syringes, small needles, not subconscious, sub Q injections, not subconscious, sub Q injections, but shallow intermuscular, which I will discuss in another video. And preferably you need to inject at least 4 days a week, at least. On Monday, Wednesday, Friday would work, but we want 4 days to be optimal, right? So yeah, 150 to 250 milligrams of testosterone. Second compound is human growth hormone. Well, if you're in early puberty, which I would assume you guys are not, and I don't want you to be because you shouldn't take drugs, but anyway, if you're in early puberty, you would know that by just taking a normal Tanner test or just looking at yourself in the mirror. You should be looking into growth hormone peptides, because when you're that young, for example, just pubertal boys, peak pubertal, your growth hormone levels are through the skies. And what does growth hormone peptides do? When it's through the skies, it just multiplies it actually. Okay, so you should not be looking at the direction of growth hormone when you're peak puberty. But if you're not post puberty, but just later stages of puberty, that's where HGH comes in. Dosages for a human growth hormone, if you're doing generic, absolutely, I think most of you guys are doing generic, I would go as high as, if you can afford, 12 units daily. Actually, even more. Just, you guys are gonna not like me for this and call me a dumbass. But in my experience, not my experience, but my knowledge, because I don't take drugs, and just as high as 16 a day. Okay, but this is the thing. Some people, not me, some people cannot endure the side effects like joint water retention. So start absolutely low, 4 units. Just keep adding each 2 weeks, a couple units on it until you're comfortable. And if you get the side effects, then you just go a couple items back where you were comfortable and you sit there. Preferably, for my hypothetical case, it will be around 6 to 14 units of growth hormone daily. Okay, and third compound would be a dihydrotestosterone derivative, or I'm just explaining the dihydrotestosterone derivative. So, for example, couple of the best compounds for this example is either mastron or methanolone or primobolan. We all know that we have a shortage of these two, right? But if you didn't have shortage, um, I would do both potentially. Why? Well, Astron, these two we're taking it. Why? For upregulation of dihydrotestosterone, because it's people online say it's dihydrotestosterone DHT is cope and it's terrible for your health indicators and just your it's a looks minimizing, yeah, but it's really not if you're under 16 15. So I would do around 1-to-1 ratio for your mastron and testosterone. So if you're doing 150 test, you should do 150 mast, and then around 1-to-1 primo as well. But if you're still aromatizing a lot from the testosterone, you should do 2-to-1 primo to testosterone. So if you're doing 150 milligrams of testosterone, then do 150 mast and 300 mgs of primo. That will make sure your estrogen is quite low. It will some likely crash it in some cases, but not really. So yeah, those are the trinity of puberty bone growth, right? So now let's get into the bonuses. Also, yeah, bonuses. But before that, DHT compounds. DHT is a strong form of testosterone where it absolutely binds to your ARs in your bone cells, and it's quite known for uh, enhancing periosteal bone formation. So and osteoblasts, and actually sometimes negatively affecting osteoclasts, which is a good thing for us. So yeah, bonuses. People are not gonna like me for this. Insulin, more specifically, glargine or Lantus. Oh God, okay. Lantus. So Lantus, in my opinion, insulin is the greatest thing that happened to bodybuilding. Okay, but why Lantus? Why insulin? Don't use any other insulin other than Lantus. So why Lantus? Lantus, uh, well, so you're taking growth hormone and Lantus synergy plus the aromatization from the testosterone, which helps bone formation. Lantus and growth hormone will actually maximize IGF-1 production because just how do I put this? Well, it drives it drives nutrients into muscle, but your bone cells also have insulin receptors that can lead to obviously osteoblasts. Also, it's commonly proven insulin and HGH synergy can absolutely skyrocket your IGF-1 levels. So there's also some bro science, not proven, but bro science, that taking Lantus with growth hormone can not ideally lead to 5 to 8 times your IGF-1 levels for the few hours of its peak of when you just consume, like you're eating a lot of food. Is that true? 5 to 8 times your IGF-1 for a couple hours? Doesn't seem so, right? It doesn't seem like it, but that's some bro science for you guys right there. So yeah, I would absolutely be careful when you're taking insulin. It has killed people, but Lantus is long acting, so it shouldn't harm you. But don't take it. I'm just saying, if you're taking it, again, if you're taking it, I'm trying to help you be safe with it. Don't take these. These will harm your body. Do not touch these compounds. Do not touch drugs. I'm just telling people how to do it safely if they're already doing it, if they're already in the rabbit hole. I'm not recommending these will kill you. These will harm you. Okay. Atlantis, it shouldn't harm you unless you're already extremely insulin sensitive. So and then I would just buy glucogen tablets, glucogen. So if you're feeling hypo, some symptoms would be like, well, God, cold sweats, cold sweats. Oh God, jeez. Okay, cold sweats. That's the best I can tell you. Cold sweats. When you're getting cold sweats, you know you're fucking fucked. Not fucked, but you know you need to take action. Cold sweats, kind of nausea, I guess. Some lightheading. What else? Just hunger, I guess. So you pop like 5 glucogen tablets, and then right after that, you just eat fast acting carbs, and then followed by just slow acting carbs. So yeah, insulin. Other than this, another bonus I would say is a compound called teriparatide or teriparatide. Um, well, we obviously know it's been used it's very commonly used in osteoporosis for absolutely just uh, touching pathways like RUNX2, what I don't know how to say it, WNT, BK2 pathways. WNT pathway, sorry. Wrong, I said, just reading to osteoblasts, and then, yeah, and then I honestly, I've honestly studied these, but, there are some other ones that can reduce osteoclasts. I'll be honest, I haven't researched those, I'll research them, but these are the test DHT and growth hormone. They're already your golden spot. These are just for the bonuses. I would really not recommend any of these, obviously, but if you're doing it, please just be safe. And when you're doing these, when you're taking these, food is mandatory. You need to be consuming. Okay? You need to be consuming. So let me tell you this. If I told you drink a protein shake before every meal, would you do it? Would you be able to do it? Probably not, right? So, but do it. It's better for you, right? You drink a protein shake, and then you force feed yourself. You need to do that. Also, if you're taking insulin, Atlantis, you need sleep. You need sleep. So get off your fucking phone. I know, kind of hypocritical for me as well, but I'm not taking these compounds. So get the fuck off your phone, please, and then go to sleep. What else do I have to say? That's kind of it. These are just the golden spots. So test DHT compounds, growth hormone compounds, or growth hormone itself. That's your golden spot. Then you have shit like, obviously, insulin, which can absolutely help in clinical studies that it's shown to help, not in real life, because I wouldn't know. And obviously, teriparatide is most common. I don't know if it's the most common, but it should be the most common used in osteoporosis. So, yeah, orals, Anavar, no. Also, another thing, all these compounds, they should be long-acting because your bone cells, listen, this is one thing nobody tells you. Your bone cells respond best to long-acting, long-triggering pathways or methods, if that makes sense. So, test SIP, MAST-E, growth hormone. Just, you don't have really option for growth hormone, but Atlantis and teriparatide, we don't even know. Another compound I would say absolutely is good in clinical trials that's proven and you shouldn't absolutely not touch it is obviously trenbolone, because it sensitizes your bone cells, your bone tissue, sensitizes your bone tissue to IGF-1. So when you use trenbolone with something that increases growth hormone or increases IGF-1 or both, that's gold. Now, I'm not saying take it, it's side effects, transomnia, trend sweats. I know people who didn't sleep for 3 days. Like, I'm being genuinely real, motherfucker. I know people who didn't sleep for 3 days on trend, like 200 megs a week, like something medium, not high, not low. But trend is in clinical studies for bone growth should be the clinical study rats that want to grow bones best friend. So ideal cycle dosing for a rat that wants to grow bones in a clinical trial, or I'm saying this for the doctors that want to improve osteoporosis or improve just bone growth in deformed patients. Doctors, I would say do 250 milligrams. Make sure your patient is sub 18% body fat. 250 to 350 milligrams of testosterone, around as high as, not as high as possible, but as high as tolerable trenbolone dose. Start with Tren Ace. Tren Ace is kind of harsh. If you can't handle Tren Ace, add Tren E and just higher the dose until you're tolerable. So what do I say? Everybody's different. I guess start with like 60 mg of Tren, go up to like, most people can probably handle 200, 300. Maybe you're not the person, but from what I've seen. So let's just say 150 milligrams of Tren E. As we said, 6 to 12 units of growth hormone, generic. Or you shouldn't use generic because it's illegal and you should not use illegal shit. You should talk to your doctor. But 6 to 12 units for doctors to know about this. And around 20 micrograms of teriparatide daily, obviously, and do that intermittently. So around 6 to 8 months on, 6 to 8, and 4 to 5 months off. And Atlantis insulin, start with 10 units. In the clinical trials, not in real life, 10 units, go up to 20, 25, 30. Kind of dangerous. I've seen people do 30 and they're kind of good, but you're not that guy. And I've seen guys do 15 and go hypo in the fucking and go hypo and suck, like their life sucks. and your life would suck if you go hypo. Side effects, sorry. Side effect of these compounds, well, test lead to aromatization, close your growth plates if you're in puberty, or if you're prone to just high aromatization, just fuck your life up. I know some people who live off 10 milligrams of Aromatics daily. Jeez, yeah. Obviously severe, severe system shutdown of your HTPA, which is, some people don't really care because they're like, all right, when I'm coming inside a woman, sorry, when I'm consensually, nicely mating with a female that's within my age. Oh, no. College is not gonna like this one, but yeah, HCG and HMG will do the job. So yeah, system shutdown, obviously aromatization. When you're taking DHT compounds, high doses, crash the estrogen, which can make your life suck. From growth hormone, you will feel water retention, which will also kind of be sucky, as long as you're not stupid with the dosing and stuff. Lantus, you would go hypo a lot. You're probably gonna go hypo a lot if you're starting out, but you shouldn't, because it's a long-acting compound. You should just keep glucogen tablets in your car if you're driving, or just in your backpacks, or just around you, and just food at all times. Also, you should be eating. If you're not eating when you're on insulin, you're just, sorry, you're just not an intelligent person. What else? Bone maturation if your estradiol is not intact. Other than that, hitting a vein, that's probably not mine. Just, that's probably one of the biggest, scariest things. If I took these compounds, would be hitting a vein. Injecting into a vein is fine, but just hitting it there hurts. Not for me, because I've never done it, but people who've done it say it hurts badly. So yeah, if you're taking these, obviously you shouldn't take it. But if you're down the rabbit hole and you know the dosing and stuff, you're fine. Just be confident. Know that you're loved. I'm kidding. Okay, but you're loved. But yeah, just as long as your estrogen's fine, you're good with the dosing, you get regular blood work done, you're checking your liver, your HTL, your all that shit, your blood, how it's, if it's soup or not, hematocrit level, just all that, your kidneys, you should be good. You shouldn't take these, but I just want you to be safe. That's where I come in. So yeah. Please follow me more. I'm gonna make so much political videos just for educational and fun purposes. I'm not a politician. I'm fucking 51 years old. I'm 51 years old. Political videos, history videos. I love history, Turkish history. You guys gotta be like, who's this Pajit? Like, what? Oh, my ancestors are Aryans. No, I don't think that. Embrace your brown skin, motherfucker. Anyways, anti-racism. And but yeah, more pharmacological videos, ascension videos. I'm posting this on YouTube. I wouldn't post it on TikTok because I wouldn't get embarrassed or bullied in school, so it's quite easier to post.